All right. So on this segment of the program this morning, we are going to be touching base with our health, but majorly we are bridging the gap for cancer care in underserved Nigerian communities. Why are we doing that? We find that when things of care and of course support systems are brought up, most of the time it's always targeted at the urban centers. But we have a non-governmental organization out there trying to bridge that gap this morning, and that's why we are connecting with them. Joining me on the phone line, I have Dr. Omolara Fatiregun. She is Chairman, Board of Trustees, Nana Fatimah Bamigbetan Oncology Foundation, and she's on the phone line this morning. Madam, it's nice to have you on Your Side Mirror. Good morning.
Good morning, Victor.
And how are you doing?
Thanks for having me today. I'm fine, thank you.
Great. So let's connect with the ideals behind this particular non-governmental organization. What's the thrust, or perhaps what's the reason for the establishment of Nana Fatimah Bamigbetan Oncology Foundation?
Okay, thank you so much, Victor. If we want to step back, take a few steps back just to establish a little background here. We know that there is the rising incidence of cancer in Nigeria. And as an oncologist, the patterns we see in the clinic is that cancers in people of African descent, they behave differently.
Right.
So apart from the fact that there's underfunding, right, we see that the patterns are actually different. Now, for the common cancers like, breast and prostate cancer, when our people of African descent, including Nigerians, present, they come in at earlier ages.
Okay.
In the sense that you see younger people when compared to most developed countries. We also notice that they tend to be much more aggressive. If someone comes and says, I just noticed the symptom a few months ago, and here the person is with full-blown, well-advanced cancers.
Right.
And so, so there's actually an urgent need to continuously study and identify, the risk factors, for these behaviors of these cancers in our people.
Okay.
As well as, treatment modalities that are important to increase cancer survival. But we know that, unfortunately, like you said, resources are concentrated in some places versus the other.
Right.
And so there's also limited funding for research in sub-Saharan Africa generally, and of course, which includes Nigeria. And so that is what led to the establishment of this foundation. So the Nana Fatimah Bamigbetan Oncology Foundation was actually established to honor the legacy of Nana Fatimah Bamigbetan.
Okay.
By advancing oncology education and patient care through strategic scholarships and research funding. Collaborative partnerships, with academic institutions, while ensuring transparency, sustainability, and measurable impact.
Right.
So what we want, so one of the main things we're doing is to raise funds to support research. I mentioned that these behaviors of these cancers tend to be different. And so we need to support our clinicians. We need to support everyone working in the cancer space, all the way from basic scientists, all the way to the clinical scientists in, building research.
Right.
Being able to go in there and study this process as well.
All right, so let me just interrupt you a bit. Let me just interrupt you a bit so that we can get a clearer background to this. And I love the way that you've painted the background to this particular subject. But for those who might not know who you are talking about, this is a foundation set up in memory of Nana Fatimah Bamigbetan, right?
Yes.
So for those who do not know her, who is she?
Okay, so Nana Fatimah Bamigbetan was a cancer survivor, and we lost her a couple of years back. And to honor that legacy, her husband, who was formerly, very prominent in the political space, wanted to honor this legacy. She was an entrepreneur, very impactful. Her life really touched a lot of people until she passed on after surviving cancer for a while.
Right.
And so to honor that legacy, this foundation was established,
which is very,
to help
very good.
support research.
So how long has the foundation been on now?
So it's basically this year.
Oh,
right.
Okay.
There has been a lot of work in the pipeline behind over the past years, but it was officially launched this year. And
Good.
we have, yes, basically.
All right. So let's look at what you really you're talking about research for cancer advocacy and the likes. So give us some more understanding of what this foundation seeks to do and how they are carrying this out.
Okay. So just like I mentioned before, the foundation seeks to raise funds, right? Because I feel that the scourge of cancer in Nigeria is actually a national call to action. It's not, it involves all of us, right? But we know that there are several competing interests when it comes to the political will and being able to fund this. So what the foundation seeks to do is to raise funds and give these funds in form of grants to researchers, right, to conduct different levels of research in terms of being able to identify risk factors, to look into people who are receiving chemotherapy, right, as a treatment. How can we do it better? Okay. How do we ensure that our patients survive, and, we are able to reduce the
mortality rate
from cancer? Yes.
All right. So even talking about that now, so at the moment, what's the prevalence rate now from what you guys are finding underserved communities? What does it look like in those communities compared to the affluent areas?
Oh, because, it generally will speak to Nigeria as a whole. Because that even when we talk about the urban or the rural areas, we talk about access to care, essentially. Most people, 80% of people in Nigeria still get care from the public space. And so even people who are able to afford the private care are just in a little bit below, 10 to 20%. And so that doesn't actually improve the coverage as a nation. So now what we see mostly, we still see patients presenting with different types of cancers, mostly in the advanced stages, which is stage 3 and stage 4.
Right.
Whether it's breast, whether it's prostate, because there are quite a number of factors that lead to delay, access to care. And even those who make it into the system, what are the risk factors? How do we make things better? And all these things fall back on the bedrock of evidence-based research, right? It still comes down to the fact you identifying what is right and how to make things better, essentially. So incidence for cancer is mostly in advanced cases,
right,
across board, yes.
Which is quite unfortunate. So now what the foundation is seeking to do is how to enlighten Nigerians so that they can present early for those who are showing signs, right?
Yes. So it's not only even enlightening them on, we'll take it a little bit further. We'll fund studies that help us identify the risk factors. Now, if you know what leads to this aggressive nature of cancers in our own population, then you know that you want to tackle that head on, right? What are the causes? What should I limit? What should I do? What are the things we can put in place to reduce even the incidence, not even early diagnosis now, the incidence of this cancers to start with. And for those who get diagnosed with cancers, how do we make their lives better? How do we make sure that, the side effects, the impact of the side effects of chemotherapy doesn't really, we still need to take that to research, right? And discover these things, and then we advise the clinicians on how to do things.
All right. So at the moment, it means funding is very, very crucial to all of this from what you've said so far. How is the foundation approaching the issue of funding? What are the things that you'll be doing? How would you be raising funds?
So essentially, it's like I mentioned before, that it's a call to action for everyone. You don't have to be a billionaire to be part of this cause. If you are too, you can also be part of this cause. So it's about donating to the foundation. increasing awareness about research generally across the country, and also ensuring that we're able to sensitize as many people as possible, especially our clinicians too. So we are trying to raise funds. We have a contact support that people can actually reach out if they want to know more about the foundation in terms of donations.
All right. Okay, we'll talk about how you can reach out, but an update coming in. It's a flash update from the control room. It's talking about a broken down container laden truck, loaded one at that, just immediately after Oba Akran intersection inwards Agege. This is Agege Guinness, opposite Wema Bank. All right, broken down truck there. It's loaded. This is opposite Wema Bank. Okay, it was Agege. So take note of that. Those of you that are there, the driver making frantic efforts for it to be evacuated. It's not affecting traffic for now, and motorists should be cautious as you drive along that corridor. All right, so this is to seek it's a clarion call, but at the moment, do you have people on board yet that are already supporting this cause?
Yes, we already have quite a number of donors already, and we are about to roll out the first set of grants in collaboration with academic institutions. We already have people who have donated to this cause, and that would enable us start our pilot grants, which we are currently in the pipeline.
All right.
And so for people, yeah.
So how does it work really? So the doctors will apply for the grants?
Yeah. Yes. So in order to ensure transparency and proper management, the Emerging African Trust Foundation would be handling the donations coming in, and so we have a contact person there. So we will be releasing a call for proposal in the next few months, directed at academic researchers as well as medical students on various cancer-related topics, and from there would pick the best ones that are not only feasible but carry high impact. Then we issue the funding to them, and after that we ensure that their findings are published in peer-reviewed journals. So that can help us in synthesizing guidelines going forward with regards to cancer treatment.
All right. We'll find out the amount in terms of the grant that will be issued, but some messages are coming in here for you, Dr. Fatiregun. This one says, good morning. It says, okay, I just lost that. All right, just a second. It says, good morning, Doc. Please, I am in my 30s and my parents were diagnosed with different kinds of cancer. Also, I have relatives from both sides also suffering or died from cancer. Does this mean I am 100% going to get it? Sheon Ibrahim is sending that one in. So this is a very, very scary question, Doctor.
Yeah, so that's a little bit of digression from what we're discussing today, but it just further solidifies the need for research. Okay. Because you were diagnosed, because your parents, you have a family history of cancer, doesn't put you 100%, right, of you being diagnosed with cancer, but it increases your risk.
Okay.
And so that's why most of the time when we have people who have a family history of cancer, we always want to screen and carry out surveillance at very early ages. So I would advise that you get in touch with an oncologist, either in LASUS, we have specialists in LASUS, we have specialists in LUTH, and a few general hospitals across Lagos State. So they can properly direct you to where to go to. And one of the things, let me just add this, Victor. One of the things reasons why we want to do in this population is to identify those genes that are passed from one generation to the other. So that once we pick it up in anybody, we know this person has a risk factor for developing cancer, right? Okay. And then we're able to conduct earlier surveillance, we're able to go after this and practically achieve cure with this group of patients.
All right, then.
boils down to the fact that we need research.
That's very true. This one says, good morning, Victor. Please ask your guest, is cancer more common now, or are we just hearing about it more because of awareness campaigns? Jide is sending this one in from Ikorodu. So what will be your response to that, doctor?
Yeah, so I feel as an oncologist, I feel it's an interplay of both factors, right? People are much more aware and they're coming out for diagnosis. The health care system is much better in terms of awareness. People know that cancer now exists.
Right.
But the patterns we're seeing in the clinic with people of African descent is that they come in with earlier ages, right? So the average age for diagnosis of prostate cancer in the Caucasian population could be as high as 60. But in our own part of this world, you find a 40-something-year-old coming down with prostate cancer. And so that is alarming, right?
Right.
So it's an interplay of both factors. People are much more aware, but these cancers are occurring more.
All right. So we have limited time on the program. Quickly, more reactions coming in for you. This one says, Lagos Traffic Radio, thank you for bringing the doctor to the studio. Please, ma, does your foundation provide financial help for people who cannot afford cancer treatment? Thank you. Shikemi from Manguru is sending that one in. Shikemi, thank you so much. So do you guys provide that?
Yeah, so that's why I mentioned that it's a call to action for everyone, right? There are other foundations that provide direct patient financial support, right, in order to undergo their treatment. But for us, we are focusing on research. So as some other foundations are looking into funding the treatment, we want to discover how to do things better by using the platform of research in Nigeria.
All right, then. So for those who would like to connect with the foundation, those that are listening to us right now, they want to support the cause and ensure that at least we have a kind of financial bank that will help in terms of research, that will help in terms of treatment for those underserved communities. How can they get in touch with you?
Okay, so you can get in touch with Dami from Imagine African Trust on 081 705 86763. So you'll be able to find out more about this cause and how to support.
Dami from African, what do you call it?
From Imagine African Trust.
Okay, Imagine African Trust. Okay. Let me just see what that number is again. Imagine African Trust. And you said it's 081 7058 6763.
Yes.
Okay. All right. I'm sure that those that are listening to us right now will be able to pick from that. 081 7058 6763. By the time you call that number, definitely you'll be able to get the right answers, especially as relates to the accounts that you can donate to and be part of this particular noble cause, which is geared at saving lives, saving Nigerian lives, to be very, very precise. Dr. Fatimah, we will look for a day. We'll get you in the studios, and then we can talk much more on this and, of course, what the foundation is doing. But your parting thoughts on the program this morning, what's your message?
So, essentially, I would say that this is a call to action, and it takes more of a national strategy, not just governmental, but also there's a strong role for us to play as a population.
All right. We'll leave it at that for now. It's nice having you on the program. Thank you so much, madam.
Thank you for having me.
Okay, then. So we're trying to see how we can bridge the gap for cancer care in Nigeria. We're doing that from the viewpoint of the Nana Fatimah Bamigbetan Oncology Foundation. And you heard from Dr. Omolara Fatiregun. Of course, she is very much the chairperson, board of trustees for that particular foundation. And she's been able to take us to the classroom this morning. A brief break. When we return, we do our birthdays before we switch gears to Build Right.